emergency COBRA meeting being held today over the latest strikes, with ministers discussing using the military and civil servants to cover staff shortages, especially in the border force. But the government also saying armed forces to be drafted in to help the NHS when ambulance staff go on strike next week. Let's get the latest now with our political reporter, Katherine Forster, who's outside Downing Street. And getting the indication from Oliver Dowden, Katherine, who's chairing these meetings, talking about a robust approach. They're really sort of starting to dig in on all of this.
Yes, they are. I was at the lobby briefing in the last hour or so, and the Prime Minister's spokesman was saying very firmly a line that we're hearing over and over again, that the government has accepted all the recommendations from the independent pay review bodies on public sector pay, and they feel clearly that they have done their bit. Now, of course, many of those awards were given before inflation hit over 10%, so they are now effectively real terms cuts in many cases. But yes, contingency planning going on. Oliver Dowden, Chancellor of the Duchy of Lancaster, Minister for the Cabinet Office, has been coordinating these throughout, and not Rishi Sunak, who will be on a G7 call. So in the next hour or two, there will be a COBRA meeting with the Home Office, Home Secretary, Transport Secretary, the Defence Department and the Health Secretary, working out the specifics. We understand that there will be up to 1,000 military personnel brought in to assist with border force, because of course they are striking, and also in helping paramedics and driving ambulances potentially. Now, I understand that they're not allowed to drive blue light calls, so flashing sirens, going through red lights, etc. But they will be basically taking some of the less urgent calls. We were asking if potentially lives could be lost as a result of these paramedic strikes. And of course, the Prime Minister's spokesman wouldn't be drawn, but did say that there would be very, very significant disruption this week. So a very difficult time for the government. They don't want to up their pay awards because they don't want to embed inflation. They say that it would cost every household an additional £1,000. They say inflation is going to be half what it is now, hopefully, by the middle of next year. But difficult times for people, bills rocketing, pay falling in real terms, and people trying to go about their normal business may struggle this week. And worst of all, if you need an ambulance, you can't guarantee necessarily that it will be there for you. Yeah,
and in particular, I mean, the Army indicating they may only be able to cover 10% of the cover, for instance, given that they've got limited manpower as well. But it seems that attitudes are hardening. We've got the Shadow Health Secretary, Wes Streeting, who's been on a visit to the Lister Hospital in Stevenage with Sir Keir Starmer, calling it a betrayal of patients with a reckless and appalling stance on strikes taken by the government, and calling Steve Barclay, the Health Secretary's approach, a complete joke.
Yes, well, Labour obviously very keen to capitalise on the chaos which seems to be enveloping the country as these strikes begin. I would say I was at a health event last Thursday, and Wes Streeting, Shadow Health Secretary, did say then very clearly that a Labour government would not be able to give the nurses 19% that they are, of course, asking for either, but that certainly they would talk. Now, Steve Barclay, the Health Secretary, has said that his door is open, that he's happy to talk to the nursing unions, but that what he is not prepared to do is talk about the specifics of pay. And pay is not the only issue by any means, but certainly a fundamental sticking point. So we really do seem to be at a stalemate, and the much talked about legislation to restrict strikes certainly doesn't look like coming in this side of Christmas, so won't be of any help to preventing these strikes in the immediate future.